perimenopause, which is a period of a woman's life that spans 7, maybe 10 years or so before and after menopause, which is the time of our last menstrual cycle. There is a major hormonal transition state that happens. Specifically, estrogen levels are fluctuating, and more problematically, estrogen starts declining. And when that happens, it results in widespread remodeling of our brain, of how different brain regions are connected, of how our brain is utilizing energy. And it also, because estrogen is neuroprotective and plays a role in amyloid and tau pathology, it changes how our brains accumulate and clear these toxic proteins. And this metabolic shift that is happening to the brain during perimenopause results in a lot of symptoms for women. A lot of women will start to complain of brain fog. That is probably the most common acute complaint that we'll hear from women, and that is really related to changes in brain metabolism related to these hormonal fluctuations. It's also important to realize, though, that while the brain is undergoing some of these structural changes, we're also experiencing these secondary consequences of these hormonal shifts that can also negatively impact the brain. So things like more anxiety, more depression, lack of sleep, all those things will negatively impact the brain. They also impact our desire to exercise, for example, our desire to be socially engaged. So there's a lot of direct effects of perimenopause and menopause on the brain, but then there's a lot of indirect effects that also happen. One way that these hormonal fluctuations affect someone's risk for Alzheimer's disease really does relate to estrogen and estradiol levels. So we know that the brain has estrogen receptors. And as you may have heard, estrogen is neuroprotective. Our brains like estrogen. So during this perimenopausal period, our brain is trying to really absorb and take in as much estrogen as it can. And these estrogen receptors are located in high densities in regions that are related to Alzheimer's disease, like the temporal lobe or the hippocampus, which is our memory center. The brain will start upregulating all of these estrogen receptors in efforts to kind of soak up as much circulating estrogen that it possibly can because it's protective. But if there is no estrogen there, the brain can suffer in terms of its ability to generate new connections between brain regions, in terms of its ability to repair brain cells or neurogenesis and neuroplasticity, but also importantly related to these toxic proteins that we spoke about before, proteins like amyloid and tau. Estrogen seems to impact the accumulation and clearance of these proteins, which can impact someone's risk for Alzheimer's disease. For women who've undergone surgically induced menopause or medically induced menopause, this really results in an abrupt decline in female reproductive hormones. This abrupt decline seems to be very problematic for the brain because the brain doesn't have the opportunity to upregulate these estrogen receptors and to get more estrogen because estrogen supply is immediately cut off. Women who have undergone surgically and medically induced menopause seem to be at a higher risk of dementia, and a lot of the original research on menopause and its relationship to Alzheimer's disease came from these early studies that showed these women having a higher risk of Alzheimer's disease afterwards. What can you do about it? This is always challenging because usually the reasons for undergoing surgically or medically induced menopause mean that you are likely not a great candidate for hormone replacement therapy, which may help combat some of the negative effects of perimenopause or an abrupt decline in reproductive hormones that happens in this type of situation. So, for women who are in a situation like that, what I would say is that it's really important to think about all of your other risk factors. Hormones are not the whole story, they're just one small piece of the puzzle. So, think about your cardiovascular risk. That's also equally important. Think about your mental health, also equally important, and some would argue more important than hormonal health. We have more evidence that cardiovascular disease and mental health is more strongly related than hormones. So those things are really, really important to focus on. And then, of course, how do you work on your sleep, your diet, your exercise? All of the other factors that you otherwise would be thinking about are extremely important if you're in a situation like this.
We hope you enjoyed this video. To access a free Mastering Brain Health course led by Dr. Richard Isaacson, visit ind.org/learn. And to directly contribute to IND's research efforts, visit ind.org/donate.